As you know, two parts of the President's reform bill include a discussion of Medicare fraud and Medicare overpayment, as well as a provision to get quite a few children, I believe the number is 4 million, who do not currently have insurance covered. And our next speaker can address that aspect of the need. As I told you before, Dr. Francine Kaufman is one of the lead researchers in childhood diabetes in this country and currently a professor at Children's Hospital in Los Angeles. Dr. Kaufman.
Thank you, Bruce, and good evening, everyone. I can't tell you how exciting it is for me personally to be up here and see each and every one of you out there able to voice your opinion, however divergent they may be, and to have Congressman Schiff bring us all together to talk about something as important as our health care, and particularly the health care for our children. I spent a really busy day today at Children's Hospital. I saw 23 children with diabetes, many of whom are struggling to be able to take care of their disease, and many of whom are struggling, their parents, their grandparents, whoever may care about them, to ensure that they have the medication and the access to health care that is so vital for them to stay healthy and productive as children and throughout their lives. One of the issues my patients face is that they will grow out of being in pediatric care and go into the adult world already with a chronic disease. I can tell you that I often spend hours for each one of them to find a care provider who will perhaps see them, who has a chance and an opportunity to care for them, because most of them will walk out of childhood without access to health care insurance at all, because they have aged out of the entitlement program from our state of California, and they have aged out of their parents' insurance. If we don't take care of these young adults now, we will all suffer the consequences of children growing up with chronic diseases who become young adults and have no way to care for their incredible health care needs. In addition to our need to care for children with chronic disease, we must care for every child in this country. Every one of them must have access to health care for the preventive services and for the opportunity to be healthy as children and to grow up to be healthy young Americans, and hopefully one day older and old Americans. So the issue is that every child deserves access to health care. In our state right now, many children, and across the country, many more children are going to lose their access. We're going to cut $178 million out of healthy families in the bill that's in front of us in Sacramento, and this cannot be allowed. We can't lose the opportunity to enable children to stay healthy and well and to become productive members when they reach adulthood. My Children's Hospital right now, when I left, our emergency room is filled with children who will wait hours, perhaps up to 4 or 5 hours tonight, to be seen, often for what are primary care services that could be delivered in a much more cost-effective way and in a way that will enable them to actually maximize their health. So I applaud Congressman Schiff. I applaud all of you, and I hope you care as passionately about the future of our children as has hopefully been demonstrated